There will be a group of patients that either have severe Peyronie's disease or haven't had the desired effect from all of the medical treatments that are on offer, that end up with needing a surgical operation. There are different surgeries for Peyronie's disease, and this usually depends on the original penile length, the quality of their erections, and the degree of curvature. Providing the patient has good quality erections, then all that is needed is to straighten the penis. There are two types of procedure to achieve this. If you have a curvature of the penis, you're going to have one shorter side and one longer side. The simplest operation is to shorten the longer side of the penis. This operation is called the Nesbitt procedure, and there are different modifications of this, either plication, 16 dot, yahir, and different types of Nesbitt procedures. But in essence, they are all the same. They are all shortening procedures. The operation is very simple. It will not affect erectile function, but will shorten the penis a little more than it already has been shortened. Now this is fine if the curvature is relatively mild or if the penile length is good. Then I would always recommend that you go with a simpler procedure. For those patients that have lost considerable length, or if the curvature is quite significant, and we put a cutoff of around 60 degrees, because the more the curvature, the more length loss you would achieve, the more length loss you will have by doing a Nesbitt procedure. So that cutoff of 60 degrees would usually indicate that the patient should have the alternative procedure of lengthening the shorter side of the penis. Lengthening the shorter side of the penis is a more complex operation. We have to lift off the nerves and the blood vessels that supply the glans penis. We would then incise the plaque tissue. We do not remove it, and then place in a little graft to lengthen the shorter side. Now this is a more complex procedure. It takes twice as long, and there's approximately 20% risk that the erection quality may deteriorate. So it is a balance between erectile quality and penile length. And this discussion is had in great detail with the patient. We measure the angles, we measure the length of the penis, and we try and give some anticipation as to what length may be lost with either of these procedures. In severe disease, particularly in those patients that have significant curvatures or have diabetes and cardiac disease, they may also have poor quality erections. Now it is pointless just straightening the penis if the erectile quality is poor, because the erectile quality will remain poor. In these situations, particularly if they haven't responded to conventional medication for erectile dysfunction, then a penile prosthesis is the best way forward. This is because it treats the erectile dysfunction, it straightens the penis, and minimises any length loss. I think it is important, therefore, to have a thorough assessment, measuring all the angles, measuring the penis length, determining the quality of the erection, because then you can get an informed decision as to what surgical procedure is best for you.